Paracentesis is performed for diagnostic or therapeutic reasons in patients with ascites. The volume of fluid removed varies by the patient's pathology and reason for the procedure. For most paracenteses, remove as much volume as possible, though taking off more than 10 liters may cause significant volume shifts and hypotension. Patient comfort is paramount, so placing a good anesthetic block is essential. Paracentesis kits are available, though for large volume paracenteses, a simple IV catheter with connection tubing and vacuum bottles will work well for safe drainage of abdominal fluid. A 3 1/4 inch 16 gauge IV catheter is ideal for drainage of large volumes. The insertion site should be selected on or near the midclavicular line in the lower quadrant at the level of the anterior inferior iliac crest. Place the patient in a supine position and cleanse the site with antiseptic solution. The area is covered with a sterile protective drape. Mark the skin to clearly identify where the anesthetic block will be placed. Inject a wheal in the skin, then insert the needle perpendicular to the abdominal wall through the center of the wheal into the subcutaneous layer, where a ½ cc of solution is injected. Advance the needle 1/2 centimeter at a time into the muscle and inject another ½ cc. Continue to advance the needle at ½ centimeter increments. Maintain suction on the syringe as the needle is advanced until the abdominal cavity is entered. Once acidic fluid is obtained, the needle is withdrawn several millimeters, then inject 1 cc of lidocaine at the margin of the peritoneum to numb the peritoneal layer. Insert the drainage catheter down the exact tract of the block, maintaining suction on the syringe attached to the catheter so that it is clear when the peritoneum is penetrated. When the cavity is entered, advance the needle and catheter another 2 millimeters, then slide the catheter forward off the needle and remove the needle from the assembly. Free-flowing fluid should come out of the catheter. Attach the connector tubing to the catheter, then quickly connect it to the collection bottle. A stopcock system or tubing clamp is used to regulate the flow when transferring bottles to avoid spillage. If the flow stops before all of the fluid is removed, it is likely that the omentum or bowel wall is occluding the catheter. Close off the suction and rotate or withdraw the catheter a few millimeters to free the blockage. At the conclusion of the procedure, remove the catheter. A bulky dressing should be applied over any wound if there is further fluid leak.